Hi guys, thanks for joining with us today. Thanks for subscribing to our YouTube channel. Today we have Yuan with us. He's a floor and tile guy. He works with tiles a lot. So he injured his shoulder 4 years ago, and I have Yuan tell you guys about what kind of issues he's been having.
Yes, it was like 4 years ago, and like I told you, I don't have nothing. Doesn't have nothing to do with my flooring work because I still work in that job. But I fell off a ladder, like a small ladder, because I step on the emptiness and I put my hand to protect my head to don't happen something, and my hand it's going up more than the body accept, like that. And from then I start little by little, to have that nerve pain to saying from here, on this side, and to the lower back, but not that low, like from this point, and also a little bit on my neck. And the shoulder, I feel okay, but I can feel, that it's cracking, a little bit more. But I still working, like construction guy.
Okay.
That is my issue.
So that's the issue, yeah. So so what he's describing is that after he fell, of course, he injured his rotator cuff muscles and tendons. So and typically what happens is which is very, very common after an injury, when it's been prolonged with regard to loss of range of motion and instability in the shoulder, Yuan has started to develop some crepitus or some grinding in his shoulder, particularly his AC joint, and also his glenohumeral joint. So typically what happens is that after a while, after a few months or more, the pain in the shoulder itself subsides and the inflammation subsides. But what he does, that leaves him with is a lot of pain where that particular muscle has to compensate. So in this case, his chest muscle has to compensate, and the subscapular muscle has to compensate. So everything's rounding forward, and then after that goes on for quite some time, Yuan started to also have some neck issue. And so even though he has neck pain, it's really not coming from the neck. It's actually coming from the compensation for all the muscle in the what we call the parascapular region of his scapula. And it's also now affecting him in the low back region or mid low back, because he's constantly using the rubber mallet, right? Yeah, to pound or to hit the towel in there. So as you can see, a lot of compensation is going on. So what we're going to do today is we actually will mobilize the shoulder joint itself, and then we'll adjust Yuan's upper back. And we're going to do a lot of therapy that I've been using on patients for the past 18 to 19 years, with me specializing in with the rotator cuff injuries. And we're going to get Yuan to be moving really well. Two big issues that Yuan is having right now after we have examined him is that he has the loss of ability to move his arm behind his back. Okay, and the other one is just having what we call an external rotation of the arm. So you can see here, we'll use his left arm, his good arm first here. Here you can see he comes back with external rotation really well, and no pain with that at all. Yuan, of course, and this is his good arm. So you can see here. So this is the first thing that we'll notice right away from Yuan. Of course, you guys can't hear it right now, but he can hear it and he can feel it. Is that it does make some noise, the cracks, yeah. And you can see this is far he goes back. So external rotation is quite limited even when I'm trying to get him back. So that's gonna be our biggest thing that we're gonna try to release for Yuan, and he's gonna feel a lot better. So we're gonna do a lot of therapy with him today, and it's gonna be painful. You're gonna see him grimace a lot, but we're gonna get him moving really well. So you ready, Yuan?
Yes, sir.
Okay, buddy. All right. So first thing we're gonna do is just examine Yuan a little closely, and we will actually adjust his joint to release the AC joint and the glenohumeral joint for him. Go ahead and relax here for me, Yuan. What I want you to do is just relax your arm for me, okay? Sure. Stay right there. Definitely. Excellent. Good. Good job. Good, Yuan. Hold it. So what you want to do is just relax your shoulders.
Sure,
the key is to drop this trapezius muscle down. Typically with patients after they injure their shoulder, they have a tendency to fire up the trapezius muscle and rise up on them like this, trying to protect the shoulder joint. We don't want that. We want them to drop that down so that they can actually use the deltoid muscle more efficiently when they raise the arm up. So now we're gonna actually release the posterior deltoids and also the teres muscle on him, and some of the supraspinatus tendon. And he should be able to raise his arm up really easy now. Before, you were doing what you want. You were moving here and moving your head towards your arm, right?
Yes.
To get that up.
Yes.
A little easier?
It's easier.
Good. All right. So now we're gonna do some therapy on U1. Stay right there for me. Push down for me, U1. Good. Again. Good. And relax for me. What I usually do it for those of you guys out there who's watching this, trying to get some tips on how to release the shoulder, is that I always try to get the shoulder abduction to come back first, okay? So if you don't have any shoulder abduction, what happens is the shoulder will keep, the trapezius will keep compensating, and the deltoids are taken out of place. You know, when we do a shoulder press, it's not about your rotator cuff, right? It's actually about your deltoids. So we want to start to teach the deltoids or the shoulder itself to fire rather than using other muscle, which are in this case here, the injured rotator cuff. So bring this up, go ahead and push up on me. Good, keep going, U1, good, again. And relax for me, go ahead, drop it down, go all the way up for me. All right, now go ahead and do that yourself, U1, up and down. Any discomfort? Pretty easy, looser?
Yes, it's
Okay, good, all right.
I just feel that cracking thing.
You still feel the cracking, yeah. And again, the cracking, guys, is coming from the instability that comes through after an injury because the tendons have been overstretched and those ligaments have been overstretched. So after we get U1 better and he's feeling better, we will definitely give him exercises to really strengthen the whole rotator cuff region and also the deltoids and also the scapular, musculature. And that's always the second phase. I always tell all my patients this is that, if you have a dirty car, you want to wash it first before you wax it, right? Rehabilitation or doing strengthening exercises is like waxing your car. You don't want to be waxing your car when it's dirty. You want to get the range of motion back first. You want to get the arm to be moving well first and the pain to be much more limited or less before you start to rehab any muscle back. So next thing we have you do is go face down for me. Back up here from the table. So now we're gonna see how his external rotation is with his shoulder here. Actually, can you scoot that way a little bit from me? I'll show the chair that can be away from the wall here. Go ahead and sit down for me. Go ahead and sit down. And bring slowly back on you. And there it is, guys. And that's how we want the shoulder to be. So it should be able to. That's where he was, when we first worked on him. And the crepitus or the noisiness should actually be much easier because now all the tendons and ligaments around it are much more stretched out and it's letting go, and most of the dysfunction in the AC joint is released on him. And you can see here's vertical or 0 degrees, and we're able to get him back with pretty much ease to almost 55, 60 degrees. And that's definitely much better than what he was, and that's pretty much up to par with this left side too. And here it is right here. The key is that he's doing that with less pain, right?
Yeah, sure.
Right to you on, all right. And again, the abduction is still going to be fairly good and fairly consistent with that. So now again, he's been having this for 4 years, so this is not going to correct, of course, within the first visit. But as you can see there, we're able to get 90% of the range of motion back, and it's pretty consistent most of the time when this technique is being done this way. U1's kind of tighten up a little bit. He's going to lose maybe 10 or 20% of it. And as you work on him a few more times, he's going to be back to where he is. And then with us showing him the stretches that he needs to do for his shoulders, and then eventually in a couple of weeks have him strengthen his shoulder up, he's going to feel great. So any question at all, Yuan?
Just about
the neck. Yep. So next thing we'll treat is his neck to actually take some of the compensation out from his neck. So, but anyway, thank you for joining us today with regard to a segment for rotator cuff injuries, 4 years removed. And if you guys like our channel, please subscribe, and thanks for joining us again.